Health Minister Dr. Phaahla has announced that several provinces are already in a fifth wave of COVID-19 infections. That follows an uptick in daily infections recorded in the past week. What does that mean then for the country, which has now come out of the national state of disaster declaration specific to COVID-19 and effectively relaxed regulations around the management of the virus? Let's talk about this with Stellenbosch University's Dr. Joe Barnes, who's an epidemiologist. Dr. Barnes, always good to have you on the channel. I'm not sure how much of the minister's briefing you were able to catch this morning, but I am keen to know your thoughts around what it means for us now, at least for parts of the country, to be technically in a fifth wave.
Good morning, or is it good afternoon?
It's afternoon now, Doctor. But morning somewhere in the world.
My clock has gone haywire. And to you and to our viewers, I'm really concerned about the, I can say, official communication from the authorities in many ways having been unclear, contradictory and all over the place. Some say we are in a wave and some say we aren't. There seem to be no consensus on how to approach the general public. I heard that the Department of Health said that urged people to use common sense while they put new regulations in place. Now, common sense rests on your having knowledge and on what to do and understand how these things work. Most of the communications we've heard in the last 2 years consisted of rules. Wear a mask, wash your hands. There's very little background information as to how and why these things should happen. So on what must you base your common sense if you're not an expert in these matters? Mm-hmm. So I am concerned that partly the confusion comes from the fact that in some places we are probably on the brink of a wave. In other places they're still a little way behind. Whether the wave is going to be really steep or much more like a molehill, in other words, broad and flatter, we don't know. It depends on how sick the subvariants of Omicron that are now causing the upswing will make people, and we are truly hoping that it's going to be like the original ones, making many more people ill, but not seriously and not as many deaths.
And given that point then, does the classification of waves or the announcement of a wave still matter greatly in South Africa when you consider that at this point, when you look at the numbers, even when you do see, say, 4,000 infections recorded in one day, you see about 4-5 deaths. Yes, those are still massive losses to their loved ones, but compared to where we were a year ago, it's come down significantly.
That's a very wise question because it also couples to your previous question. If you keep on announcing these waves and on the brink of a wave and these things are on the upswing, but you don't tell people exactly what you now expect them to do, that is people start ignoring messages that scream fire, fire all the time. So I am really concerned that we don't seem to have a very coherent approach to this, and it is being run on a day-to-day and a week-to-week basis, and sometimes based on what I really feel are iffy statistics. And the one thing that it really bothers me is that they base it on the positivity rate of tests, and that changes all the time. The requirements change all the time. So comparing what we have this week with what we had last month is not a good indicator. I think they should stop that.
Do you think then, Dr. Barnes, there should only be a serious conversation, shall we say, between government and the population once we see a significant rise in serious illness and in death? Is that when we should then be having a serious talk?
I agree that one can warn, but the warning stands all the time, that the simple things that you can do and that you can afford, such as washing your hands and wearing a mask, will not hurt. It can only help. So those things stand all the time and they can bear repeating now and then. But to warn, it's almost like waiting for the crisis to happen and screaming fire, fire. And this now happens so often, it has entirely lost its ability to galvanize the population into doing something different. What must they do different? There's no information on that.
And what must happen next is still the recurring question. That's why there were these proposed regulations, which we're expecting to get an announcement on in the coming days and weeks, right? Which direction should they go? And are there any regulations, given where we are epidemiologically, that would make a difference?
You know, there's one thing that I feel has been really, I can almost say, if you pardon the word, botched, mismanaged, and that is the vaccination campaign. That still is. Vaccination is still our best protection. We are way, way below what the WHO sets as a minimum standard for protection, and that is 70% of the population. Only about 60% of the over 60s had one shot, while 35% of the under 35s have had one shot. So, and in places, there's only 10% of the entire adult population of that area has had vaccination. I think that is really shameful. I tried to get a booster shot a couple of weeks ago, and I found a large number of the vaccination stations around me closed. It took me a morning of driving and searching and phoning to find one that was open. That is not going to help. So we really, really need to do the vaccination route, and anti-vax and vaccine hesitancy sentiments are increasing in the face of somehow the authorities seem to have lost interest in doing the vaccination, and it seems that they are also thinking that if people have had COVID sometime in the past, that they now have some sort of immunity. That immunity doesn't last, and it is not as strong. We desperately need more vaccination.
Is there anything left for government to do, Dr. Barnes, in cases where people simply don't want to get vaccinated and in the last year or so have still not been swayed by any of the arguments that are pro-vax?
My point is that those arguments weren't very well brought across. And we need a revamp of the vaccination drive. And it's also not going to help if you close all the vaccination stations. So this is a chicken and egg situation, and the fewer people pitch up, the more they close, and eventually you have a lame, non-functioning system. That whole system needs a redesign and re-energizing. And you know what influences most of the hesitant people the best is when somebody they trust, be it their gogo or their religious leader or somebody, talks to them and says, we encourage you to do that. That is proven to be by far the best. But that is not, that avenue of asking people to do this has not even been investigated or tried.
Dr. Jo Barnes from Stellenbosch University, always a pleasure to speak to you. Thank you for your time.